try to contain an outbreak. Finally, scientists are developing a synthetic infected skin to help with treatments for eczema sufferers. These stories and more in this edition of Healthy Living. Hello, I'm Linor Moudou. Thank you for joining us for another edition of Healthy Living. Millions of people around the world drink alcohol. Some do it on social occasions, others turn to alcohol to self-medicate depression and anxiety disorders or to reduce stress. However, experts warn that binge drinking and alcoholism can put people's health and safety at risk. Alcohol is linked to a range of health problems, including liver cirrhosis, cardiovascular disorders, and various cancers, according to the World Health Organization. Liver cirrhosis is among the most severe consequences of long-term heavy drinking. Alcohol also increases the risk of heart disease and stroke. In its latest report on alcohol and health, the World Health Organization says the death rate from alcohol consumption worldwide has dropped slightly in recent years, but it warns incidents of heavy drinking remain unacceptably high. Here is more.
The Global Status Report on Alcohol and Health in Treatment of Substance Use Disorders presents a comprehensive overview of alcohol consumption, alcohol-related harm, and policy responses, as well as treatment capacities for alcohol and drug use disorders worldwide.
We can definitely say that there is no risk-free alcohol consumption because there are many health conditions which can be worsened or can be developed because of alcohol consumption, including development of alcohol dependence. And the risks and probability of development of these conditions is very difficult to predict. At the same time, we also can say with confidence that very low levels of consumption, very infrequent use, not necessarily bring harms to individuals.
The World Health Organization's report reveals that an estimated 400 million people live with alcohol and drug use disorders worldwide. Alcohol-related deaths contribute to nearly 1 in 20 deaths globally each year. This occurs through drunk driving, violence, alcohol abuse, and disease. Alcohol abuse also makes people more susceptible to infectious diseases such as tuberculosis, HIV, and pneumonia. Globally, at least 23% of 15 to 19-year-olds are considered current drinkers. Of the WHO report's estimated 400 million affected by drug and alcohol abuse, 209 million of those lived with alcohol dependence.
Alcohol use disorder is a more broader concept than alcohol dependence. According to the International Classification of Diseases of the World Health Organization, the concept of alcohol use disorder includes alcohol dependence and harmful pattern of alcohol use. The alcohol dependence is a disorder, a condition which has very specific diagnostic features and very specific requirements for making such diagnosis.
The WHO says death rates from alcohol consumption worldwide have dropped slightly in recent years, but incidents of heavy drinking remain unacceptably high. Improving access to quality treatment for substance use disorders is key to helping lower the incidence of unsafe alcohol consumption.
Dr. AbuYazid Bashir is a family physician in Abuja, Nigeria. He discusses the impact of alcohol on our health and what treatments are available.
There's someone who is always in desire of drinking alcohol. That is where the term alcoholism is referred to. There are people who take once a while, maybe at an occasion. You don't call them alcoholics. There are early symptoms, early signs. Someone will be taking the alcohol. Well, for example, he takes 1 cup today. He takes tomorrow, next tomorrow. Then he will stop feeling the effect of the alcohol. So he needs to increase it. He needs more and more of this alcohol. From 1 bottle, graduate to 2 bottles, graduate to 3 bottles. Sometimes he will try to see if there is possibility that he will stop. but he will not be able to stop. He will waste a lot of resources in taking this alcohol. There are short-time alcoholic effects. He will start having impaired judgment and coordination. It may affect his brain to have something like depression. And then there is long-time effect because it can affect his liver and cause liver cirrhosis. Liver is an organ that is very soft, so it becomes cirrhotic. It will become like rubber, burnt rubber, and subsequently it transforms to liver cancer, hepatoma. It can affect his heart. We call it alcoholic cardiomyopathy. It can also affect his mental health. That's what we call alcoholic encephalopathy. And there is a stigma associated with it. Don't take his word because he's a drunkard. So these are some of the things in environment, influence, peer group pressure, the implication of the long-time effect of this alcohol, like alcoholic cardiomyopathy. The only treatment is an eye for an eye. When the heart is affected, then that heart must be removed. There must be a heart transplant. And if the liver is affected, there must be a liver transplant. Extremely expensive procedure.
Do you think excessive alcohol consumption is a problem in your community? And what do you think can be done to support people who struggle with alcohol addiction? Here are some reactions from Cameroon.
Yes, I think excessive alcohol is a real problem in our community because many people, like, we can categorize it in three dimensions or three different people. We have men, we have women, and we have youth. It is a very problem in our community because for men first, it diverts them from their responsibility in their families, in their companies, in their society. Women, secondly, they don't take care as usual of their home. And for youth, it diverts them from their studies and from their rules in their homes towards their parents.
Alcohol in this community brings, how can I say, unemployment. It brings disorder. It brings prostitution, all kinds of delinquency for the nation.
When women drink, they'll say, I don't know, you find early in the morning, I can only take the example of where I grew. Early in the morning, you go to the market or you go somewhere, you find a woman. She can even be married, lying in the gutter because she got drunk. She drank and she got drunk. You can see a man, he's 40, he's 20, he's 30, doesn't even have a goal in life, because when he has money, you just go and buy alcohol to drink. You say, no, I prefer to drink because they have this saying, when I'll die, I go with my stomach.
The first solution for those that suffer from alcohol addiction is to confine them to a psychologist, for them to be follow up so that they can find a solution firstly for their problem. Secondly, they have to encourage them to economize the money they spend in alcohol so as to invest in their businesses, so as to take more care of their families and to ensure a better future for their children.
For me, I think it's necessary for campaigns to be done. Campaigns in regions, campaigns in villages, in towns, so as to re-educate the people. It can be the youngsters, it can be the old people, because anyone can be addicted. So we need campaigns so that we can educate them about the harmful use of alcohol for our nation or for our community.
Those who struggle with alcohol addiction, a center can be created for them. You know, when somebody has fallen, he needs someone to lift him up. So they can create a center for them so that they should teach them how to control themselves. Because there are some people that no matter how much he has, you go and buy alcohol. Now to help him, you can create a center, I think, in a bush far, where he's far away from alcohol. He can learn to be connected to nature and to avoid such things.
Authorities in the Democratic Republic of Congo have approved the use of 2 mpox vaccines to try to tackle an upsurge of the infection and to help quell a dangerous new strain spreading in the country. The regulator has issued an emergency use authorization for both Bavarian Nordic's Bava.co shot, Genos, and LC16 made by KM Biologics. Both tools were widely available in Europe and the United States during the global outbreak in 2022. Congo has seen 20,000 cases and more than 1,000 deaths from mpox, mainly among children, since the start of last year, according to government's data. WHO and scientists warn of a new, more deadly strain of mpox spreading in Congo's South Kivu province. Scientists are developing a synthetic infected skin to help them develop new treatments for eczema sufferers. They say it will allow cosmetics and pharmaceutical companies to test products as if they were being applied to natural human skin.
This is a lab-grown synthetic infected skin sample. Researchers at Sheffield Hallam University say it could be key to helping people with eczema.
What we're doing is we're making an inflamed skin model and looking at the differences between normal skin and inflamed skin and how bacteria have this representative of atopic dermatitis. And then what we do is we put healthy skin bacteria on the models to make a more representative model, because previous models in the past have only used inflamed skin, but they haven't factored in the fact that the skin microbiome has an effect on how the skin grows.
The school's commercial research unit is collaborating with U.S. consumer goods giant Colgate-Palmolive. Their goal is to perfect an artificial skin that not only simulates the full thickness of human skin, but also accurately emulates its microbiome, including bacteria, fungi, to identify what triggers it to flare up and how to treat it once it does.
For too long, it's been trial and error for a lot of people. Where you've got something like this, a novel research approach, it means that there's an opportunity of understanding better what works and why it works. And so the opportunity to help people manage their eczema more effectively is just really exciting.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on X at Linoch Mudu. Until next time, stay well and strive to make every day a healthy day.